Hello everyone, welcome back to my channel. So today we are going to see what points we have to cover while taking the case of a patient or examination of a patient. When patient enters to your clinic or enters the hospital, from that time itself your case taking should be started. So let's see what are the points that you have to observe and what are the points that or the points and the questions which you have to ask to the patients. So let's start. So the firstly, patient examination organization. So in this, these are the points like subjective, objective, assessment and plan. What are these means? So these are subjective. Subjective means what patient is trying to tell you, what complaints he is trying to tell you, what he is suffering from, he is trying to describe in his word. That is what comes under subjective. So firstly you have to be a good listener. Like all doctors are listening to us and then we are reaching to a particular conclusion that yeah, this is what happening to that patient, then we are getting the complete case and then we can reach to the final remedy, and this is what which is helpful for the diagnosis. So firstly, what patient is saying, what he is trying to explain his suffering, so you have to pay attention to that thing. That is what the subjective mean. Then objective, what examiner observes. You should be a good observer. Always you should be observing the patient gesture, the patient behavior, the patient how he's sitting, the way he is talking, how the way he's narrating his complaints, everything which you have to, you can observe, that you have to observe in this objective skills. This skill should be developed in each and every practitioner. No assessment. What is the assessment? So what the examiner think is going on means what the case we are writing on the paper, means everything what patient says that we can't write on the paper. So what exactly he's trying to tell you, what exactly his suffering is, whether he's giving the justify to his complaints or not. No, means some patient don't tell you in very detail, or they are feeling very much more but they are not expressive, or they couldn't express their sufferings or anything. But it is our duty that we should write it down and we should know. So this is what assessment is. Then the plan, what they intend to do about. Okay, means what we have to do next. This is the part of a case taking. So we have to plan wisely and we have to give a justice to that patient and give a treatment, a proper cure to the patient. So this you has to keep in mind as per the viva point of view. So this has the mnemonic like SOAP, like subjective, objective, assessment and plan. This is SOAP, so keep in mind. Now pain history checklist. So mostly many patient comes to our OPD is complaining about pain, headache, stomach ache, or pain in lower back, or cramps, leg pain, this type of pain. So firstly, while taking the history of a pain, you should be knowing all these points, or you should be covering all these points like location, onset, severity, time, worsening factor, elevating factors and radiations. So what is location, at what exact location it is present, what exact location the pain is present. Then onset, how is the onset, gradual, slow, or it is having intermittent, or it is quick and sudden onset, or it is very spiking onset and then it is gradually decreasing, or such kind of history also will be easy to reach to the remedy. So you have to look for the onset. Then severity, how is the severity of the pain, it is bearable or it is not bearable. Sometimes the kidney patient or the kidney renal stone patient are dancing in front of you, they are jumping literally with the pain. So if you will say yeah, calm down, chill, that will never work. He will throw everything on you and then he will run away from there. So you have to see the severity with the justice to the patient, with the justice to your case, and with the justice to the cure. So severity. Then time, how is the time, intermittent, regular, or quick time for small duration. This time means duration. Then worsening factor, what are the aggravating factors we say in homeopathy. So look for the aggravating factor, that will be very helpful for your remedy selection or similimum. Then elevating factor, what are the exactly the cause is, why it is happening. If the patient is complaining for the forehead pain and he is continuously watching tvs or phone, or he is IT professional is, then you have to see for the factor. Then radiating pain, it is the pain is radiating from the frontal to back or back to front, or any sideways, so you have to see the radiation. Then patient's profile, what are the patient profile means, living situation or a lifestyle. This gives you the more idea about the lifestyle diseases or the occupational diseases which are present nowadays. So you have to ask the living situation or the lifestyle, or at least you should ask the occupation of the patient and address. That will give you a little bit idea of what the disease is, or it is related to that, then it will give you the good idea. Anxiety, whether that patient is having the anxiety disorder or something, that you should be checked. Okay, and this you will be observing while telling the or narrating the complaints, so you have to keep an eye on the completely eye or completely focus on the patient itself. Then depression, whether that person is in a depression, he will not tell you, no, I am suffering from a depression or I am having depression. No, he'll not tell you. But you have to observe, you have to make your questions very tricky, that he should tell you everything. That is, from then only you will get the depression symptoms, and there you will reach to some conclusion that yeah, he is having depression, and then you can carry out your further case. Then daily activities, describe a typical day, what exactly he does, like physical activity, mental activity, what he exactly does, that you have to see by noting the daily activities. You should ask the patient like, what you do in a day, tell me in detail, starting from the morning to the night, what you do, that you have to listen to the patient. Then environmental risk and exposure, what if the some dust allergies is there, then ask that patient ki tell about your surrounding, whether there is the palm tree, sometimes they are having allergy for that, whether there is a some pollens present near your house, or whether there is a some kind of tree like krishna tree it is present, that is what a trigger point for asthma patients. So you should ask the environment also. Then relationships, what are the relationships, either the patient is introvert or extrovert, that you can come to know. Some nature you can come to know, whether it is whether the patient is quarrelsome, or the patient is silent, or patient is very friendly or something, that you can come to know by the relations. Then support system or stress, whether he is having any stress of finance, or whether he is having any stress of college or anything, you can get to know. Then support system, whether he is supported by his family or not, that thing you will get to know. Then conscious and differential. Okay, so in this fainted person, if the person is fallen down in front of you in a on a road, and what you will see firstly, so you will examine the patient. Firstly you will see ABC, that is airway, B for breathing, and C for circulation. So you will be seeing that first. Then if any child is having infantile convulsions or any illness, then we will ask to the attendee or ask to the guardian who is present with him. Then the shock, what whether that person is gone under the shock, like some hemolytic shock or cardiac shock or electric shock, anything you can come an idea. So an unconscious patient, you should be looking for these points. Then any head injury is present, you will be asking the patient to wait. You will ask patient that is you are feeling like vomiting or something, then you will get a little idea. You will check the head, you will check for the blood marks, or you will check for the mark or injury. So then stroke, CVE, then heart problems, asphyxia, then poisonous, epilepsy, diabetes. These points you will be covering in the unconscious patients. Okay, so this is having mnemonic like fish shaped. So this was the examination of a patient, which points you have to cover, and these points are very important for the exam point of view, means the students which are going to vivas or something, like these are the clinical points to know. I hope you like this video, and if you do, then consider subscribing. Thank you.